My name is Robert Bache, MedicareBob. I own Senior Healthcare Direct, and I've helped over 100,000 people understand what Medicare is, how much it costs, what does it cover, what are my coverage options. This video is designed for YouTube, although I will also post it to our Facebook page so that the 80,000 people that follow us can also see this video. Now, in this video, I'm going to help you understand. So there's a lot of other people online, a lot of resources you have. I promise you, what I'm about to go over with you is how I've helped the over 100,000 people with choosing the right Medicare coverage for them. All right? So in this video, we're going to cover what is Medicare, how much does it cost, how and when do I sign up, what does Medicare cover, what are my coverage options, a Medicare Advantage versus Medicare Supplement, drug coverage, Part D, and I'm going to cover all this in this video, and I promise you, if you follow along, you'll never be sold a plan. You'll actually choose the plan you want because you'll understand your options. So let's first talk about what Medicare is, who's eligible for it. So Medicare, everybody who turns 65 is eligible for Medicare as long as you've worked 40 quarters. If you've been on disability, so if you're under 65 and you've been on disability for at least 2 years, you're also eligible for Medicare. Okay, and also if you get awarded back disability payments and it goes past 2 years, you'll get Medicare right away as well. So Medicare is for people that turn 65 or older, or someone who's been on disability for at least 2 years and is under 65. So that's Medicare. Medicare is insurance, but it doesn't cover everything. So let's talk about how much is it, when do I sign up, what does it cover? So how do you sign up? If you're drawing Social Security benefit and you're turning 65 years old, you'll automatically be enrolled in a Medicare A and B, and you'll get your Medicare red, white, and blue card in the mail about 3 months before you turn 65. If you're turning 65 and you're not drawing your Social Security benefit, you will not be automatically enrolled. So you'll have to do something proactively to enroll into Medicare. You have 3 ways to do that. You can call Social Security. You can go to Social Security's website. I'll put the link in this video for you. Or you can go to the Social Security office. The easy way to do it is if you're turning 65, I would go ahead and just do it online. If you're taking Medicare later and you're not drawing Social Security, I would go to the Social Security office because you'll have to give them a form proving that you were still working so you don't get a penalty. So if you're turning 65, you're going to be automatically enrolled and you'll get your card about 3 months before. So what does it cover? How much does it cost? Well, there's 2 parts to Medicare. There's Part A and there's Part B. Part A is for your hospital bills, and this is what you've been paying taxes into for your whole life. So as long as you have paid into your 40 quarters, or if you've been married to somebody who's paid in for 40 quarters, then you'll get Medicare Part A for free. Now, Medicare Part B, on the other hand, is not free. It's going to cost you, for this year, about $135 a month. Now, I'm going to use a lot of generalizations when it comes to cost, not exact cost, because these things do change plus or minus $10 throughout the years. And this video will be useful for everyone over the next 5 to 10 years on what Medicare covers and what it costs. So if you're drawing Social Security, this $135 a month will automatically start coming out of your Social Security check. If you're not drawing Social Security, then you'll get a bill quarterly from the government every 3 months. For the 135 times 3 if it's quarter, or it comes out of your Social Security check. Now, what's nice about Medicare is it's the largest network or no network in the country, because if you have Medicare A and B, you can go to any doctor, any hospital in the country that accepts Medicare. So there's no HMO, no PPO is the point there. All right. Now, the problem with Medicare is it doesn't pay everything. So you're going to have a bill if you only have Medicare. So if you go to the hospital, every time you go to the hospital, you're going to have to pay around $1,400. Now, what's important here is that's not an annual deductible, meaning when you go to the hospital, you pay $1,400, and then if you go back, you don't have any more out-of-pocket costs when you go to the hospital. That $1,400 or the Part A deductible is going to be every single time you go. Now, it lasts for 60 days. But if you go into the hospital for different reasons or outside of the 60 days, you're going to have to pay that roughly $1,400 every time you go. Now, if you're admitted in the hospital, you're going to have to pay, starting day 61, you're going to have to pay around $350 a day. Again, that's not the exact amount, but it's over $300 a day, and that's starting day 61. All right. Also with Medicare Part A, you have skilled nursing facility benefit. Medicare pays the first 20 days for free, but then starting day 21, you'll have to pay around $180 a day. All right, for the next 80 days. So Medicare Part A, very simple. It's going to cover your hospital bills, but you have to pay the first $1,400 roughly every time you go. It also covers skilled nursing care, and it's going to give you the first 20 days for free, but then starting day 21, you have to pay around $180 a day. So that's Part A. Now, Medicare Part B, this is for all your medical and doctor bills. So this is what you're going to use mostly on a monthly or quarterly basis. If you use Medicare, is going to be for medical, doctor, lab work, imaging, anything that's outside the hospital is going to be Medicare Part B, your medical bills, durable medical equipment, stuff like that. Very simple. Medicare has a very small annual deductible. This year is $185. So you have to pay the first $185 of your Part B services, your doctor bills, before Medicare is going to pay anything. After you pay that $185, Medicare is going to step in and pay 80%. And that means you have to pay the other 20%. And the real scary part to that 20% is there's no limit. So for those of you that have had health insurance before, you know typically you have a deductible you pay, and then your plan steps in, and then you have to pay a portion, like 20% or 30%, until you reach what's called a max out of pocket. Okay? Well, with Medicare, there is no max out of pocket. So if once, Medicare is only going to pay 80%. So your 20% that you're responsible for is unlimited exposure. So that's very important. So there's no max out of pocket with Medicare. All right. So that's Medicare A and B. Give you a summary. It's going to cost you about $135 a month. There's two parts. A is for hospital. B is for medical, doctor, imaging, lab work, everything that's out of the hospital. It doesn't pay everything by itself. So for Part A, you have to pay roughly the first $1,400. And then starting day 61, you have a copay of like $300, $350 a day. And it also covers skilled nursing for the first 20 days. But starting day 21, you'll have to pay around $180 a day. With Medicare Part B, you have a very small annual, so that's one time, $185 deductible. Once you pay that very small deductible of $185, Medicare is going to step in and pay 80%. And that means you have to pay the other 20%. And the scary part is no limit to that 20%. What's nice about Medicare, no referrals, no HMO, no PPO, any doctor, any hospital that accepts Medicare. So if you're traveling, you can go there. If there's a specialist, if you live in Florida and there's a specialist in Houston you want to go to and they take Medicare, you can go because Medicare is accepted nationwide. All right? So that's Medicare. So we talked about what is Medicare, insurance for people that are turning 65 or older, or if you've been on disability 2 years, you're eligible for Medicare. How much it costs, how do you sign up? For most people, it's $135 a month. If you're drawing Social Security, you'll automatically be enrolled. If you're not drawing Social Security, you have to register with Social Security office. What does Medicare cover? A and B, A hospital, B medical. You got a per occurrence deductible. That's the big problem with Part A. Part B, you have the 20% with no limit, but you can keep your doctor because there's no HMO or PPO. All right? Now we're going to talk about what are my coverage options. And this is where so many people online try to make this complicated, or the carriers mail a bunch of stuff and it makes it complicated. Here's the biggest favor I'm going to do for you right now. There's not 100 different coverage options for Medicare. There's not. There's really only 2. Because everything you're looking at, everything you're getting in the mail, all the phone calls you're getting, the stuff you're seeing online, okay, everything fits into one of 2 categories. There's nothing other than this. So everything you're looking at, so if you have a dining room table and you're like my clients and you're getting bombarded with stuff in the mail, okay, then I'm going to help you right now. You're going to be able to identify that everything will fit into one of 2 piles on your dining room table. Everything is either called a Medicare Advantage Plan, or a Medicare supplement. Another word for supplement is Medigap. Okay? Everything you're looking at, it's either going to be this or it's going to be that. Okay? So you're going to be able to put it in two piles. So how do we identify this, right? How do I know if it's an Advantage plan or a Medicare supplement? Well, let's talk about it. First, we're going to talk about Medicare Advantage. So the first thing you want to understand about a Medicare Advantage plan is it is not a supplement plan. Okay? It's not going to fill in the holes to Medicare. It's not going to pay the bills that Medicare would normally leave for you. It does not work with Medicare. But you're also not giving up Medicare either. You're still a Medicare beneficiary. The idea behind an Advantage plan is that private insurance companies go and can negotiate with Medicare, the government, and they tell the government, listen, we're a private company. All we do is insurance, so we can do it more cost effective than you. We can do this better than you, or at least as good. Okay? So it's a private alternative, kind of like your group insurance. It's how it's going to work. So now this is an educational video. Advantage is very regulated. So I have to tell you, I'm not allowed to say, a carrier has this plan in this area and here's the copay. So I'm going to give you generalized out-of-pocket costs that are associated with Advantage plans. We offer Advantage plans. They are for a certain type of client. But again, my goal is that you understand so you can choose the right plan for you. So let's talk about it. So the way it works is they're not free, okay? But you do see these advertised as zero premium plans. But they're not free, okay? Because they are getting, remember that $135 a month that's coming out of your Social Security? Well, instead of that going to Medicare, it's going to go to a private insurance company instead. So the money, you won't see the difference. It's still just going to come right out of your Social Security, but it's not going to go to Medicare necessarily. It's going to go to Medicare, and the Medicare will forward it to whichever private company you choose. All right? Now, so you will not use your red, white, and blue Medicare card if you go with an Advantage plan. Instead, they're going to mail you a policy, a summary of benefits, and a card. And the insurance plan will override. So it will work instead of Medicare. So I'll give you a few examples that will make this make perfect sense. Remember when I shared with you about Medicare Part A, how it has a $1,400 deductible every time you go to the hospital, roughly? And I'm sure there's going to be somebody commenting on the YouTube page with the exact Part A deductible, but the point is it's about $1,400. So the way it works is if you have an Advantage plan, it's not going to pay that $1,400 every time you go to the hospital. Because again, you're not technically using that benefit. It's going to replace it with its own charge. And a popular copay for the hospital, again, not exact benefit, but a popular, very, very average, would be if you go to the hospital, it doesn't pay the $1,400. Instead, it's going to charge you, say, $350 per day, days 1 through 7. So if you go to the hospital for 2 days, it would be $700. All right, cool. That's less than the $1,400. But if you go for 7 days times 350, that's more than the $1,400. So it's not better or worse there, it's just different. The point there, though, that I want you to understand is it doesn't pay the $1,400. It's going to replace it with its own charge. All right? Another example. Let's say you go to the doctor. Okay? Well, you won't have that $185 deductible and then 20% that you have to pay. Instead, you'll have a copay. Maybe primary is $10. Maybe a specialist is $45. Again, that could be $5 and $50 or $25 and $75, depending on where you live. Okay? Or the plan you choose. But the point is it doesn't pay the 20%. It's going to have its own copay. All right? Let's say you go get an MRI or a CT scan, okay? So let's say a scan. Well, that might be, again, the point is it's not like Medicare is paying $80 and you pay $20. It's just gonna have a copay of, let's say, a very average copay will be for an MRI or a CT scan on some plans will be about $450, okay? Now, what's nice about the Advantage plan compared to Medicare that's good is, remember, Medicare had no limit to the 20%. Well, the Advantage plans, they do have a max out of pocket, which we call, MOOP. Now, for HMOs, it might be $5,000 depending on where you live. PPOs, they might be $10,000. So, why did I just use the term HMO, PPO, right? That's because Medicare Advantage plans, because the $135 is not going to Medicare, it's going to that private company, you're giving up your right to go to any doctor, any hospital in the country that accepts Medicare. You will have a network. You will have an HMO, I'm running out of room here, I apologize, or a PPO. What does that mean? An HMO means you have a list of doctors that you have one set of list that you have to go to while you're on that plan. With a PPO, you have two sets of doctors, or two sets of benefits, basically, in-network or out-of-network. And these are based on the county you live in. So, if you choose an Advantage plan, they're going to be low cost per month because depending on where you live, you see some zero premium plans advertised. But again, remember, they're still getting that $135 you're paying Medicare, but there's nothing extra, okay? But that's because it doesn't actually pay the bills that Medicare charges. You're going to have its own set of co-pays, deductibles sometimes, out-of-pocket costs. The good news is it is going to have a max out-of-pocket of $5,000 to $10,000. Again, that could be $7,000 to $12,000 or $3,000 to $6,000 depending on where you live, okay? Because Medicare Advantage plans are very county specific. If you live in one county and you move one county over, that plan may not be available there. And the big deal is you are limited on the doctors you can go to, okay? So you're gonna have a network. It's either gonna be an HMO or a PPO. There's also something called a PFFS, which is a private fee for service, which are kind of rare. But for the majority, the point is you're gonna have an HMO or PPO. So if you have an HMO, you have to get referrals to go to certain doctors. That insurance company is controlling your health care. So, they're managing your care. So if you need to get a procedure done, you might have to get what's called prior authorization, okay? So to summarize an Advantage plan, it's not a supplement, it's a private alternative or replacement to the Medicare, your Medicare A and B benefits. You're still paying the $135 a month. Some plans have no extra per month charge, but again, you're gonna have to go to certain doctors, certain hospitals. It's restrictive in your county, and you have a copay for everything you do until you reach that max out of pocket, okay? So, this is a health plan, all right? It's similar to what you've had probably your entire life, okay? But probably even a little stronger, okay? Because normally these plans don't have like a big deductible or anything you have to meet. So the point there is they're cheap per month, you have to go to certain doctors, but you're gonna have a bill for a lot of the stuff you do, okay? Until you reach the max out of pocket. Now let's talk about the only other option, which is a Medicare Supplement Plan. This is also called Medigap. Kind of confusing. A lot of the carriers refer to supplement insurance, but then in your Medicare and new book, it's Medigap insurance. Here's how this works. With a Medicare supplement, you're gonna stay on your A and your B. A and B is your primary insurance. So that means the $135 a month you're paying still goes to Medicare. That means you're gonna use your red, white, and blue card. Why is that important? Because that means you keep your right to go to any doctor, any hospital that accepts Medicare. You can travel with the plan. You can go where you want to go. Okay, as long as they take Medicare, they'll take your supplement because Medicare is your primary. Now, here's how this works. You will pay an extra premium for a supplement plan, depending on your age and where you live and the plan you choose. Probably around $85 a month to $140 a month, depending on the plan you choose. So you pay the $135 to Medicare, so you keep Medicare as your premium, as your primary. Then you'll pay an extra, let's just call it $110 a month more for the supplement, for the Medigap. But you're paying for it because it actually pays the bills that Medicare doesn't pay. So if you go to the hospital, instead of you paying the $1,400, your supplement will pay that for you every single time. If you go to the doctor, instead of you paying the 20%, the supplement will pay it for you every time. You get a scan like an MRI, a CT scan, whatever it is. Medicare is going to pay 80, your supplement pays the other 20%. There's max out of pocket, essentially is going to be just your premium, depending on the plan you choose. So the point with a supplement plan is it's going to cost more per month, but it's going to give you the best coverage you've ever had in your life. Because you know, as long as you pay your Medicare premium and your Medicare supplement or Medigap premium, you're never really going to have a bill. You go to the hospital for a day, you go for 6 weeks, you pay nothing. You go to the hospital one time, you pay zero. You go 4 times next year, you pay zero. You get a knee replacement, you'll pay zero. You get physical therapy, you pay zero. Because you're paying this premium, you won't have any out-of-pocket costs. The supplements will pay the Part A deductible and the 20% that Medicare doesn't pay. The 3 supplements that we're going to talk about. So with a supplement, you're going to pay more per month. Okay, no one's tricking you. You're going to pay more. You keep your right to go to any doctor, any hospital. Okay, and in return, you're not going to have any bills either. It's going to pay the hospital and the 20%. Now, what I do now is I typically ask somebody a question that's going to help you. You're going to get a gut feeling in your stomach. Are you a Medicare Advantage Plan person or a Medicare Supplement person? But before I do that, I have to share with you, the only time you're automatically approved for a Medicare Supplement or Medigap is when you first turn 65 and or get your Medicare Part B for the first time. So let me explain. When you first turn 65, you're in what's called your open enrollment, or when you first start your Medicare Part B. So it's really your Part B effective date. That's the only time in your life you're allowed to get a Medigap, a supplement plan, and you don't have to answer any health questions. So if you start with a Medicare Advantage Plan because you're thinking, hey, 65 is not what it used to be. I'm active, I'm playing tennis, I'm riding my bike, I help with my grandkids, I travel all the time, I do all this and that. I'm in good shape, I'm healthy. So I'm going to go with the cheaper plan. And then when my health gets a little worse, maybe then I'll upgrade to a supplement. The problem with that logic is there's no guarantee that you're going to be healthy enough to upgrade your plan from the Advantage to the supplement. So if you choose an Advantage plan, that's the risk you take, is that you may never be able to get a supplement. Because the only time you're automatically approved for this plan is when you first turn 65 or start your Part B, the supplement. So here's the question I always ask people, to help them kind of pick which one are they. Are you an Advantage Plan person or a supplement person? Because there's no wrong answer. It's health is a personal choice, healthcare is. So, what you might really like, your twin brother or twin sister may not like. Okay, what you might want, your spouse may not want. So it's very different. But here's a question that people typically say helps them to figure it out. Let's say you choose a Medicare Supplement Plan and your premium's the $100 a month or $110 a month. Call it $100 a month to make this example easy. And you are healthy and you choose the supplement plan. And you go the whole year and nothing really happens. You get your physical, you go to the doctor a couple times, maybe you need an antibiotic or something because you get a cold or whatever. And so you don't really, you don't use it a whole lot. And you go the whole year and you don't use it. And we do annual reviews in our office with our clients, as all brokers should. So if that happens and you talk to me or one of my support members, and are you going to say, Bob, I chose a supplement, man, and I didn't even get to use it. I went to the doctor 2 times. I'd have been better off just paying a little, having no premium and not paying that $110 a month because I didn't use the plan. Again, when you choose this, we don't know what the next 12 months holds, right? If we had a crystal ball, then obviously we'd all choose the cheaper plan and upgrade when we needed to. But we don't know that. So let's say you go all year and you don't use the plan a whole lot. Would you consider that $100 a month a waste of money? Like, come on, Bob, I shouldn't have got that, man. I should have just went with a cheaper plan. Or would you consider it a cost of living? Meaning, I'm 65 or older. Statistically speaking, I'm more likely to use my health insurance the next 5 years than I did the past 20. Okay? So I'm 65 or older. Anything could happen. My biggest unknown cost is my healthcare cost, no matter how healthy I think I am. And it makes sense that I make that a fixed cost. So that's a cost of living for me. So even though I didn't get to use it this year, it's a cost of living, and I'm happy I have it because I get to go where I want to go, and if something does happen, I'm not going to have any surprises. Very simple. If you answered that this would be a waste of money, then choose this. Choose the Advantage. You are an Advantage Plan person. If you look at it as a cost of living, then choose a supplement. Very simple. Because the worst case on a sup, I guess it's worst case, is you pay the premium, you don't use the plan. I would say let's go out for a drink and cheers. You had a good year health-wise. But that's the difference. So, or again, if you really don't have the $100 a month, okay? If it comes down to you not paying your rent or your electricity bill, then you're probably an Advantage Plan person as well. But if it comes down to cost of living or waste of money, so waste of money, you want to kind of gamble a little bit, go with the Advantage. If you would consider it a cost of living, it's a Medicare supplement. All right? So now you should have an idea if you're an Advantage Plan person or a supplement person. So I'm going to go over with you, if you're an Advantage Plan person, how to choose the right Medicare Advantage plan. Very few people talk about this, but I've done this a lot, so we're going to talk about it. So if you are an Advantage Plan person, meaning you really do not have the money for a supplement, which is fine, or you would consider it a waste of money if you didn't really use it, and you choose an Advantage. Here's the best way. So if you're an Advantage Plan person, on your dining room table, you go through and you have the supplement and you have the Advantage on 2 stacks. So now that you know you're not a supplement person and you're an Advantage Plan person, you can get rid of the supplement material, and now let's help you pick which Advantage plan is right for you. The biggest decision you have to make, because there's no perfect plan, so the biggest decision you have to make is, are you network focused or benefit focused? This is the choice you have to make if you're going to choose an Advantage plan, because there's no perfect plan. So, network focus, what does that mean? That means, Bob, I'm an Advantage Plan person, but I have a cardiologist that no matter what, I have to have. He saved my life, or she saved my life 10 years ago, and I'm not seeing a different cardiologist no matter what. Okay? So that's network focused, meaning there's not a doctor you're willing to give up. All right? So then we probably look at we check the HMOs, but we probably look at the PPOs, so you have that flexibility, hopefully, to go to that cardiologist or whatever doctor that you cannot live without. So that's what network focused means. If you're benefit focused, this is probably someone that's super healthy, never had any health issues, and they don't foresee themselves, even though, again, we can't predict, but they don't foresee themselves using the plan a whole lot. So, Bob, I want the 0 premium. I want the plan that has 0 premium. I want dental. I want vision. I want hearing. I want a gym membership. I want whatever is the richest plan. The doctors, I feel like a number in a ways maybe. I don't have a doctor I love, so they can tell me which doctors to go to, but I want all the bells and whistles on a plan. In this scenario, I just look through the plans and we find you the one that has all the bells and whistles, since you're flexible in the doctors. So you have to decide, are you network focused if you're choosing an Advantage, or are you benefit focused? Once you do that, it's easy to pick the right Advantage plan for you. All right, so that's the Advantage plans person. Now, let's talk to the Medicare Supplement person. So you have your stack of papers, and you would consider a supplement a cost of living. Remember, supplements also Medigap, okay? So now I'm talking to supplement people, all right? So how do I choose the right Medicare supplement plan? Here's the good news, really not a bad answer. I'm going to go over the 3 most comprehensive. There's not a bad answer out of any of these, okay? But I'll just share with you what they cover, and then I'll tell you kind of which one I like, and but there's no bad answer out of these 3. So you're a supplement person, so which supplement do I choose? Well, here's the 3 most comprehensive. Plan F, Plan G, Plan N. Now, I call Plan F full coverage. And this is because it's the most expensive supplement, but you'll pay your premium. Say this one's $140 a month. And again, it could be $110, it could be $160. It depends on where you live. But for Plan F, it's full coverage. So let's say that's $100 a month. That plan fills in all the gaps to Medicare A and B. So it's going to pay the Part A deductible. It's going to pay the skilled nursing copay up to an additional 80 days. It's going to pay that $185 Part B deductible, and it's going to pay the 20%. So you literally just pay your premium. No copays, no out-of-pocket costs, because everything is in your premium. You pay that premium, no copays, no deductibles, keep your doctor, go to any hospital. Plan G, I call greatest value. Let's say this plan, if this was the example, probably about $110, okay? Plan G is the same coverage as F. It's gonna pay your hospital bills, it's gonna pay the skilled nursing benefit, it's got the foreign travel benefit, pays the 20% for you every single time. The only benefit difference is that the G plan doesn't pay the $185 annual deductible. That Part B deductible of $185. It's the absolute only difference. Okay? So why do I call Plan G a greater value than F? Simple math. The premium's typically at least $30 difference. So that's $360 a year. And the only difference is you pay the first $185 of your Part B bills. So you'll come out, and I'm not a finance major, but you come out ahead because $360 is more than $185. So you can save some money with G compared to F. So it's a greater value or greatest value. So if I'm talking to somebody who's turning 65, I would tell them, cross off F, because why pay $360 more for a $185 benefit? Because it's the same. So I would go with G over F. But no bad choice there. There's also some changes coming in 2020 to Plan F. I have some other videos on that, but I'm not going to talk about the macro changes and stuff. But I like G because it's a greater, just for the pure math reasons, a greater value than F. Now, Plan N, I call not fixed. It's a good plan. I think it's a plan of the future for sure. And I know Chris Westfall and Justin Brock, two of my other colleagues online, are really high on Plan N, and I am too. It's not a bad plan. But with Plan N, you have 4 out-of-pocket costs. I think that's a 4. All right, so the first one is this same $185 deductible. The second one is you have up to a $20 copay for the doctor visit. You have a $50 copay for the ER, but if you're admitted, that's waived, and then it pays all your hospital bills. And then the fourth item is Part B excess charges. So what's a Part B excess charge? Every doctor that accepts Medicare has one of 2 contracts. Either they accept what Medicare says they can charge, or they want to charge over it. If you have G or F, it doesn't really matter because it's going to pay Part B excess charges for you. If you have Plan N and you go to one of those doctors that charges more than Medicare allows, then you would pay 15% of that difference. All right? So that's Plan N. Again, and Plan N in this scenario might be $95. So me, and for right now, what I know about this and the market, I would still choose G over here because it still guarantees my health care cost over N. But none of these are bad choices. So this is not me. I'm not anti-Plan N. I've liked N for a long time. And I think with some of the changes coming, N is going to be, in about 4 or 5 years, become the more popular plan. But G's been the most popular plan for the last 5 years because of some changes in the industry that are happening here next year. But I would choose G over F because it's a greater value, just pure math. And then I choose G over N because it guarantees my healthcare costs. Because for me, I would rather pay the $10 to $15 difference just to not have the copay or the Part B excess charge. If I've accepted that I'm a supplement person and I'm going to pay for it, then I'm going to go with the G plan, pay the $110 a month, and not worry about it anymore. So if you're a supplement person, I would go with G. Now, how do you choose the carrier you want? Very simple. The letter of these plans dictates the coverage, not the carrier. And I'm a top producer with with all the carriers. So they're all great to me and I'm great to them. And the ones that do a good job, they're great. And they all do a good job because these are federally regulated, okay? But Plan G is the same with every carrier. So Mutual of Omaha Plan G is the same as GPM Plan G. AARP Plan G is the same as Blue Cross Blue Shield Plan G. Plan G is the same with every carrier. The doctor gets paid the same, your benefits are exactly the same, okay? The only difference, there's one big difference, okay? One big difference. So a G is a G. Are you with me? Blue Cross G, AARP G, same benefits. Mutual of Omaha, Cigna G, same benefits. But one huge difference. Price. That's it. The price of their G is the only difference. So there's no difference in benefits. So don't let a carrier talk you into paying a bunch more money because they have a cool logo or you've heard their brand name before. All right. Now, as a broker, we only choose to represent A+ companies. Okay, A-rated or higher companies. So just because of rate stability and the whole idea behind insurance is everybody pays a little, so nobody pays a lot. So we have our probably top 10 A-rated carriers that are big enough that if they have a bad claims year, they're not coming after you for big rate increases. So, but in general, when you got those 10 major companies, some of those numbers I mentioned, the only difference is price. Your doctor gets paid the same and your benefits are the same. So the only difference is price. The letter of the plan determines the coverage. So once you know you want a G plan, then I do my job, right? Hopefully I helped you pick which plan you want. And then my office and I will get you the best price for that plan. All right? So that's a supplement. The last thing last thing we're going to talk about today. Let's see. Okay, we did that. All right. Now we're going to talk about Part D. All right. And I know you may not be able to see this board as well as I would like you to, but this is more just to pace myself so that I know, what we've talked about, what we haven't. So let's talk about Part D. So what is Part D? Part D is drug coverage. All right. Now, if you choose an Advantage plan, right, that option that was on the left, if you choose an Advantage plan, right, the private alternative, you can choose an Advantage plan that has the Part D included in it. Okay, so it's going to be included in that Part D. The Part D drug benefit will be usually included in that Advantage plan. There's pros and cons to that. The pro is there's not typically an additional premium for it because if you buy a zero premium Advantage plan, the drug plan's included in it. So all you're paying is the $135 a month for Medicare and it's got a drug benefit in it. The downside of that is you're not able to choose a drug plan that covers your medications for the lowest cost. You have to go with whatever drug plan is included there. So if you choose an Advantage plan, you have less flexibility on which drug plan you get because you have to choose the one that's in their plan. All right. Now, if you go with a Medicare Supplement Plan, you get what's called a standalone Medicare Part D plan. And that is I'm not going to say customizable, but very flexible because there's usually about 30 to 35 different Medicare Part D drug plans in every county because they're county specific. And if you have a supplement and you choose your drug plan, then, or to choose a Part D plan, you get a standalone. So what you would do is you'd give your agent, hopefully our office, I would love to work with you. You'd give us a list of your prescriptions and we put them in Medicare.gov, Medicare's website, and it actually shows us which drug plan will save you the most amount of money. So, so it's based on your prescriptions, which is nice. So a lot of times by getting a standalone drug plan, yes, you pay an additional premium of $10 to $35, but you're going to save money on your drug costs because it's covering your prescriptions for a better value than maybe the Advantage plan that you have to choose whatever drug plan's with it. So just so you know, if you choose an Advantage plan, you probably got your drug benefit with it. If you go with a supplement, you get a standalone drug plan. And that's how that works. Now, I'm going to go over how the drug benefits work real quick, and I'll close with that. Most drug plans have 4 levels. They have the deductible level. They have the copay level. They have the donut hole. or the coverage gap still currently, and then they have catastrophic. Okay? So most plans nowadays have a deductible, even if you have an Advantage plan. But what's tricky is they have what's called a tier deductible. So what they're doing is they're encouraging you to go generic. So you might have a $405 drug plan deductible for tier 3 and higher, which we'll go over in a moment. Well, let's talk about it now. So every drug plan has what's called a formulary, which is a list of covered drugs. And within that formulary, they put them into tiers, like a category. So tiers, and there's 5 tiers. Tier 1 is going to be your preferred generic. Tier 2 is your non-preferred generic. Tier 3 is going to be your preferred brand name. Tier 4 is going to be your non-preferred brand name. And Tier 5 is going to be your specialty drugs. So there's 5 tiers within a formulary of the covered drugs, and the tier dictates the cost. The higher the tier, the more expensive the prescription is. All right? So if a lot of deductibles on the drug plans will say for tier 3 plus, there's a deductible. So if you take generics, then the deductible doesn't apply. All right? After you meet your deductible, say the $405 deductible, if your plan has one, then you go into what Medicare calls the initial coverage level. I just call it the copay level. And this is what we're all kind of used to because this is where we pay a nice copay for our prescription. So let's say you take Crestor, which is wholesale, say $180, but on your drug plan, it's a $40 copay. All right? Now, once you and the drug company spent a certain amount of money, call it $4,700, and again, it might be $4,850 this year or $4,450, but it's roughly about $4,700. Once you pay that, you enter the donut hole. Once you and the insurance company pay that, the insurance company is basically saying, all right, listen, you take a lot of expensive prescriptions. You know, we've kind of given you a discounted price for long enough. We need you to kind of step up and pay more. And in that situation, the drug company pays like 70% of the drug, and then you pay 30% of the drug. And the donut hole is being phased out, so it's going away, so the numbers keep changing. Supposedly by next year, there'll be no donut hole. We'll see. In theory, for right now, let's say there is the donut hole and you're in it, and then once you get out of it, once you spend, let's say, $5,500 or whatever that amount is, you're out of the donut hole and you enter what's called catastrophic coverage, and then you essentially only have to pay 5% of your wholesale drug costs. All right? So that's a drug plan. All right, it's got a formulary, is a list of covered drugs. Within that formulary, each prescription is on a tier level between 1 to 5, 1 being the cheapest, 5 being the most expensive. And then you have 4 levels that you kind of graduate as you and your drug plan spend money. All right? Okay, so I don't know how long this video has been, but I know it's been a little while. And but I guarantee that if you've watched the whole thing, you know more about Medicare and your coverage options than your neighbor. That's a fact. You probably have a good idea. Are you a Medicare Advantage or Medicare Supplement person? Now you have a decent understanding of how prescription drug plans work, but you're not supposed to be an expert on this. Okay, you're supposed to be familiar with it, and so you can choose the right coverage for you. The expert is us. So a little shameless plug here. For those of you that do not know, my name is Robert Beisch. I got the corny nickname MedicareBob, and that's because I've been helping people on Medicare for the last 10 years, and a couple of my clients started calling me MedicareBob, and it just kind of stuck. And then people in the industry call me MedicareBob as well. And I know it's corny and it's laughable, but I like it and I own it because I love helping people. I love connecting the dots to Medicare for people because I get to help and sell a product to people that they thank me afterwards. Because now they don't feel like they got sold a plan. They feel like they bought and chose their own plan. And that's my goal for myself and all of my agents. So I have licensed agents that are trained by me and work with me every day. And if you'd like our help, the phone number is going to be listed on this video. You can also go to MedicareBob.com, which will direct you to SeniorHealthCareDirect.com, which is our company website. I encourage you, if you haven't already, subscribe to this YouTube, my YouTube channel. I have more videos than anyone else online about Medicare, and I love it. I love getting to help people across the whole country. We're licensed in all 50 states. We help people everywhere. Also, I have over 80,000 followers on our Facebook page. That's a great way to connect. If you have a question, you can send us a quick message. So please go to Facebook and just search MedicareBob, and you'll be able to like our Facebook page. So subscribe to the YouTube channel, like the Facebook page, and also I have a podcast. So if you're on Spotify, Apple Music, please feel free to subscribe to the podcast. So if you have any questions about Medicare that I did not answer, please leave a comment below. But the best thing to do is just call our office and ask for one of our licensed agents, and we'll be happy to help you.